My examples are about to.
Good afternoon and welcome to the first edition of the Global Leadership Lab webinar series for the month of November. I'm Yunus Chaudhry, your host and awesome training manager. The focus of this webinar is public policy advocacy, and our presenters are Susie, Schatz, and Munya Malunga. Let me quickly introduce them. Munya is a current Atlas Core Fellow serving as a program coordinator at the Lutheran Social Services. Munya has over 5 years of experience in the nonprofit sector and has built successful coalitions for advocacy and developed new models of service delivery and successfully managed projects and conducted research to inform the work of organizations across Zimbabwe. Munya holds a master's degree in development studies from the University of the Free State, South Africa, and BSc in psychology from the University of Zimbabwe. Susie, who's going to be leading the presentation, is the Director of Advocacy and Volunteer Services for Lutheran Social Service in Minnesota. Susie joined LSS in 2009 as the Advocacy Manager and has spent her time at LSS supporting 2,400 colleagues statewide to build relationships with their legislators and develop grassroots advocacy. Susie holds a BA in Social Work from Ohio University in Athens, Ohio, and a Master's in Social Work with a concentration on Program Development, Policy Administration from Oxford College in Minneapolis. She's also an adjunct instructor at the School of Social Work at Oxford College, where she teaches public policy on social work practice. On behalf of the Atlas Core community, I thank you both for volunteering your time and service and expertise with us today. Before I hand it over to you guys, I'm going to share some general instructions for our viewers. Please remember to fill out the webinar feedback form once you have viewed the live or the recorded version of the webinar. Our speakers will present for the first 15 to 20 minutes, and the remaining time will be allocated to Q&A. Please post your questions by clicking on the Q&A tab on the broadcast page. If time runs out or you are viewing the webinar at a later time, please connect with the speakers offline so that your questions can be addressed. With that, I will hand it over to Susie and Munya.
Great. Thank you so much for inviting us to present to you about the work that we do here in Minnesota and also the work that we do at the federal level as far as advocating on behalf of the people that we support as a nonprofit in those arenas. So you've got our PowerPoint right in front of you. I just wanted to give you a little bit more background. So first about me, before I joined LSS in 2009, I was a case manager for people with disabilities. So I really worked directly in people's homes, assuring that they got the services they needed to stay independent. So I worked with many individuals who had disabilities, older adults, people experiencing mental illness, traumatic brain injuries, etc. And in that capacity, working directly around with folks, I really saw the impact of policies on with my organization, and we were able to provide guidance and on the people that I supported. And the very policies that were intended to help them, sorry, we're getting some feedback here. Okay. So the very policies that were intended to help folks succeed in life and to stay independent in the community were oftentimes a hindrance to their ability to do that. And so I decided to take a shift in my career and move from that sort of direct support level into the policy arena and use my experience as a direct support social worker as a policy social worker to try to inform policies going forward. So you've heard a little bit about what I do as far as my current role as the Director of Advocacy. We really support our colleagues statewide to advocate on state and federal levels to build the will of the public so that all Minnesota children, youth, families, and people with disabilities and seniors can live with dignity, safety, and hope. And so we really see ourselves as sort of a connector or an intermediary for those folks who work directly on the ground to their legislators to share the impact of the policies on them. So today I'm going to talk a little bit about the federal budget process. I don't think I'll spend too much time on that. There's a lot of slides there that you can read, but then we'll get to talking about some things that you can do directly, and then also some successes that we've had through this office in supporting folks to do this type of work. So something I just want to remind you, the way that we set this up for our colleagues is to Let them always know that they are the expert on what they do and that their elected officials really rely on them to tell them what's important and to encourage them in their priorities. And so I see my role as really helping folks build those relationships. And so as I talk about this, I'm going to talk about you all, like, as you are the experts in what you do, and that elected officials really do rely on you. So just a brief overview. This is something I always go over with folks because it gets a little confusing if you don't work in this arena all the time. Today, as we talk about how the federal budget process works, I just want to be clear about who we're talking about. So there's your U.S. Senators and your U.S. House of Representatives. So every state has 2 U.S. Senators. Clearly, we just had an election. Every state has 2 U.S. Senators. They represent everyone in the state. So me as an individual, no matter where I live in Minnesota, I have 2 U.S. Senators. And those are the folks that go to Washington to represent me in the Senate. As far as the U.S. representatives, that's based on census data, and it can change every 10 years. When you look at that map that I've shown here of Minnesota, you can see that if you see numbers 3 and 4, that's Minneapolis and St. Paul. Number 3 is essentially Minneapolis, and number 4 is essentially St. Paul with some suburban areas. And then you look at 7 and 8, and those are larger districts. All of those have the same number of people roughly in the districts. But it takes much more, you have to cover much more land to get the same number of people when you look at 7 and 8. So that's how I always break it out for folks. Now with our office, the majority of our work is even smaller scale. So you break these districts down into your Minnesota districts and then your House of Representatives districts. And all the states do something different. Some have an assembly, others do other things. So this is, I'm going to speak to my reference of what I know best, and that's Minnesota. All right, so how the U.S. budget is created. The most important thing that I always remember is that the president proposes and the Congress disposes. Did I say that right? I think so. Yeah. So the president will submit a budget request to Congress, and he'll do that around February for the following fiscal year. So the federal fiscal year begins on October 1st. So the president puts that budget out there, so you may hear about, oh, the president has proposed to cut X amount of programs. Well, that's not anything in law. That doesn't mean it's going to happen. Congress still has to put that proposal into legislation to get passed. So you can always think of it, he proposes, but it's Congress's job to get those dollars out there. So then you have the House Committee on the Budget and the Senate Committee on the Budget. They pass budget resolutions. And what that means is just how much they're going to spend and how much they're going to cut. But they don't specify particular programs. That's looking at more of a sort of global look at the budget. So they pass their budget resolutions, and then they'll hold a joint conference to reconcile the differences between the two. And then when they get to that agreed upon resolution, then they'll pass it through the House and Senate. And many things always originate in the House. And some things are required to originate in the House. So if you can't get something out of the House, then it's not going to happen for a lot of different things. Then you have the House and Senate appropriation subcommittees, and that's where they draft what are called appropriation bills. And these determine the precise amount for each federal agency. So when you think of like Health and Human Services, I'm just thinking of the ones that we always operate in, like CMS and other ones. So that's the precise amount. They determine the precise amount for each federal agency. And then they have to abide by the budget resolution that was already passed. So these must pass each subcommittee, and then they're reviewed by the full Appropriations Committee of the House and Senate, which this is a long process. This completely oversimplifies all of it. And the House and Senate vote on appropriation bills and reconcile any differences. So once they resolve these differences in a joint conference committee, they'll vote again on identical versions in the House and Senate. And then that's when they pass the identical versions out of the House and Senate, that's when they go to the president to sign. Now, let me just be clear, this is how it works when things are working. Oftentimes, as of recent years, it hasn't really worked that well. It hasn't been a clear process because there's been so much back and forth and dealing in issues like sequestration. So if the budget process is not finished by October 1st, Congress will pass a continuing resolution to temporarily fund the agencies until the completed budget is in place. And so that means that they're just going to keep doing what they're doing. They're going to keep funding it at the same level just to keep government running. And if you'll recall, just over a year ago, in October of 2013, the government shut down. And that was because Congress refused to pass a resolution, a continuing resolution to temporarily fund it, and they shut down. So if this is not passed, the non-essential federal agencies shut down until Congress can pass a continuing resolution or agree to a new budget. And as of lately, we've had a lot of continuing resolutions because we can't agree on cuts and spending. So these, just to back up for 1 second, the appropriation bills that detail how much money of the federal government go to various agencies and programs. So those are very specific. And then government spending is broken into two categories. Direct spending is not subject to the appropriations process. It includes agencies such as Social Security and Medicare. And so those are usually held pretty stable, harmless. Like those were not included in sequestration cuts of the last few years. Those were the automatic spending cuts across certain areas. And then discretionary spending is not mandated by existing law and is set forth through the appropriations process in Congress each year. So that's where you're going to hear things are a little more vulnerable, and you know, they want to cut AmeriCorps, or they want to cut, you know, food stamps or whatever. So that's where there's a little more flexibility. Authorizations are legislation that's passed by Congress that provides the government with the legal authority to actually spend money. They cover multiple years and do not need to pass Congress every year as appropriations do. So when you hear that word. And here's just a nice kind of budget flow, annual budget process flow chart. And again, I can't stress enough, this is how things are supposed to work. So at the left, you can see that there's the federal agencies are who help President Obama draft his budget. And so those are those blue blocks over there that happen even before the president has proposed his budget. And then you get over to the green. So it goes to the House committee, and then it goes to the Senate committee, and they come up with a budget-like resolution that looks like overall spending. And then they break it out into their different agencies and their subcommittees. And that's when they start hearing bills. And some of those bills may include what the president proposed, or they may not. You know, in recent years, things have been so divided that it's quite possible that those bills don't include a whole lot of what President Obama has proposed, especially in the House. Then they pass those on to the appropriations reviews, the appropriations committees to review and approve. And then, of course, they go to the House of Representatives and the Senate. They pass those. And then they go to a conference committee. And that conference committee is a mix of both House and Senate members, usually from both parties who have voted in favor of the bill, probably an appropriations committee. And then they get together and they hash out the differences. And then once they can get to that, it goes back to the Senate, back to the House, and on to the president for his signature. This is, I thought, was just a good chart of kind of how spending is broken up right now. Based on the federal government. I mean, there's a lot of, I think, myths and ideas out there about what we actually spend money on, but I think this is pretty telling when you look at the increase from 2002 to 2012 and the percentage of spending that things actually are is what is in reality versus what is in the media is quite good. All right, so a few things that I want to clarify for you, and I'll reference the work that we do here at LSS as kind of how we put that into practice. So we know that the decisions that are made at the Capitol, whether it be in your state or at the federal level, will impact you, your colleagues, and especially if you're working in nonprofits, people that you may support through those nonprofits, and even how you do your work. You know, the elected officials have a tremendous amount of power when you look at the laws that they pass. And then, for example, in our case, we're greatly impacted by the work of the Department of Human Services, how they interpret those laws and what I have to do, the paperwork I have to fill out, the time I have to spend on something, the background checks I need to pass, whether or not I have to get court approval for this or that. So they have a tremendous amount of power. And again, I'll say you are the expert in the work that you're doing and on your local district. When you think about federal folks, especially our U.S. senators, they can't be everywhere. They just cannot physically do it. They all show up in these elected roles with their own backpacks, like their own experiences, their own expertise, their own employment, their history. They show up and they can be mechanics, doctors, lawyers, nurses, teachers, social workers. Gosh, we have legislators that are mental health counselors and plumbers. I mean, just all the way across the board. They all show up with their own history. We cannot rely on them to be experts in the work that we do. We simply cannot. That is up to us to educate them and help them understand what they need to know about the work that you do. So they really do rely on you to tell them what's important and encourage them in their priorities. So a lot of what we do, I think, especially in nonprofits, at least the nonprofit work that we do, is not about, fighting with other people. It's not necessarily about big differences of opinion. It's a lot about helping elected officials prioritize things differently. Because they have so many choices. They have lots of people coming to them to say, oh, pay attention to us, you should care about this. Well, we need to help them figure out how to prioritize what they need to prioritize. So just to give you some examples, my LSS colleagues, there are 2,400 of them across the state. We're actually the oldest and largest human service nonprofit in Minnesota. We're 150 years old next year. And we are blessed with sort of a built-in constituency of employees who are committed to our mission and vision. So our colleagues across a lot of different lines of service advocate and share their expertise in different ways. Just as legislators can't know everything about everything in their district, I can't know everything about the on-the-ground work. So I really rely on my colleagues. So PSS Advocacy, the first one there, that is our services for people with disabilities. And some of the ways that we help those folks interact with legislators are site visits. So we ask legislators and candidates for office to visit some of our group homes for people with disabilities. We have days at the Capitol where we have people come to the Capitol and meet with their legislators, and we help to organize that. We ask them to respond to action alerts. Something that I can't emphasize enough, some organizations I think have different strategies around, when you get those emails in your inbox, it's like, respond right away. Most of them, they're sending that because it is really important that you respond right away. We never send anything out of our office, any requests, that is not really important. We want to trust your time. We want to, protect our time. We don't want to contact legislators unnecessarily. So I'd say typically, if you're working with an organization, you can trust that when that goes out, it's actually pretty important. So our older adult services, a way that we found really effective with them is postcard campaigns. We have helped to support sending out, packets of postcards to every site where we provide senior nutrition meals. And we ask the folks who receive those meals to write on this postcard how important that is to you. And it's very effective when I hand a whole stack of postcards to a legislator and say, all of these older people in your district rely on meals at a senior nutrition site, and here's their stories. And many of those stories will say, I wouldn't be able to live in my home without these meals. And what that is code for, I would be in a much more expensive setting that would cost the state of Minnesota more money. So trying to get that story across is in the most effective way for different populations is really critical. We also have our legislators come out and go to the senior nutrition sites. We want them to sit down and have a meal with older adults and hear how important those services are in their district. So our youth services, they also bring legislators out. We often have young people testify in committees when we're trying to get some more investment during the legislative session. We ask them to send action alerts on to their volunteers. Volunteers are a great way to gain additional support for the work that you do on an advocacy level because they're really great advocates. I mean, they can tell legislators why the heck they're involved. So they're really great in that way. Our financial counseling services will often respond to legislative proposals. So I'll reach out to them and say, hey guys, how would this impact the people you support? And then we also have them testify in hearings, and they communicate at a different level of government with Minnesota's Attorney General, members of Congress. Okay, I'm going to run through here. So I've got some things that you can do to influence policy. Join coalitions. There are likely already organized groups that are working on this issue. You never have to do it alone. It's usually a built-in group of folks who you can get together with and do your work. Share your story. You bring unique expertise, and elected officials usually don't possess the same expertise that you have. It's just not possible. And they rely on you to tell them how you're going to be impacted. Show elected officials your world. That many elected officials have never set foot in some of the services that we provide. Show them how that work happens. And I have many examples of how that changed an elected official's mind. Engage with elected officials in social media. You can engage with them, send them notes on their Facebook page, their letters to the editor. Elected officials always read their local newspapers because they want to get the pulse of what's happening in their districts. So just a few examples of some recent success that we've had through the organizing that we've done. All of these that I list here are through coalition work. Most things that happen do not happen alone. An organization like ours, even though we're big and we have some resources, we could never pass all of these without the support of other organizations. So this last year, we achieved a 5% rate increase for home and community-based services. That was over an $84 million increase every year to the budget that goes to home and community-based services like senior nutrition, services for people with disabilities, caregiver respite, lots of different services for people with disabilities and older adults. Another great success, the Homeless Youth Act. In Minnesota, we established the Homeless Youth Act in 2006, and from 2006 until 2013, it only had $200,000 put in it. This was a competitive RFP to serve homeless young people. In 2013 and 14, we were able to get that number up to $6 million. And just
Susie, sorry to jump in real quickly. We're running out of time, so just wanted to sort of step in to see you are able to see the question and answers that some of the fellows are posting. So if you look at the left, you'll see a Q&A tab that will also pop up some of the questions that the fellows are posting as we speak. So you can address them maybe as you're trying to sort of wind up the webinar. Or I see that there. I don't know if you're aware of that or not. We didn't have a chance to go over it.
I'm not seeing questions and answers.
Just look to the left of your screen. There's going to be a Q&A tab in blue. So if you click on that, you will be able to access all the questions.
Okay, 1 second here. So let me just go back. Let's see. Yeah, I'm not getting questions coming up.
Would it be helpful if I read out the questions to you?
Yeah, why don't you tell it? Sorry, I just enlarged everything.
So Medha has asked you, hi Susie, did you say that the fiscal year begins in October? I thought it begins in July. And then Medha also asked, explain how fellows can influence the U.S. policy on international issues, advocacy in international issues. And then Trish Survey is asking, hi Susie, what are the essential skills that one should have to make an impact on public policy? Or you can maybe address them once you're winding up the webinar.
Yeah, I'll just wrap up these next couple things and then back to those. And I might have to have you repeat those for me. But Munya's got them. Okay. So the final thing that I wanted to talk about, and we've had other successes, is a coalition called Homes for All. And just this last year, we were able to pass $100 million in affordable housing in Minnesota. And so that was the largest investment that Minnesota has ever made in building affordable housing, which will make tremendous strides in hopefully reducing homelessness in Minnesota. Because one of the reasons we have issues with homelessness is because of a lack of affordable housing. So those are some good successes. I just wanted to include a few resources here that are good that several of these, especially the Center on Budget and Policy Priorities, try to boil things to a level that is really helpful. And then there's my contact information. And so the first question was, yes, so the fiscal year is October 1st. That's when that begins. If you'll recall, last year when the federal government shut down, it was October 1st that it shut down. So there's that. And then the second question.
How can we influence U.S. policy on international relations?
Okay, our U.S. policy, so, and just to back up to that fiscal year question, lots of organizations and even different states have different fiscal years. So that's the federal fiscal year. Our fiscal year is also October 1st at my organization, but our state fiscal year is July 1st. So that's why that's confusing. And then influence on international relations, I'm not sure if I can address that really closely, but my first thing I would mention is that is to get connected with an organization that does that, and they can provide you guidance on that. There are lots of resources out there, lots of organizations doing that work. So I would highly recommend making that connection. Anything else to add? Okay.
Yeah.
And then the third question?
With a question about what skills are required for essential advocacy. I think Trish will ask this. Yeah. What skills do you need to be an effective advocate?
Oh, I think anyone can be an effective advocate. Some important things to remember is that, again, I can't say this enough. You are the expert of your story, and you get to go in there with confidence and ownership of your own story. If a legislator or an elected official asks you questions very specific about an issue that you're working on and you don't know the answer, you can say, I don't know, I'll get back to you. I think a lot of people get held back because they think they have to know everything about an issue, and that's just not true. You get to be the expert of the work that you do, and I think that you can trust that elected officials are okay with that. They don't know everything either, and they're very accustomed to people coming and advocating to them and sharing their stories. So I think it's a good exchange in that way. So I guess some other things would be, I have really had to learn in this job to kind of put myself out there and talk to elected officials who maybe I thought were intimidating before, etc. But really, you need to think about them on a human level, and the fact that they deal with some of the same issues that we deal with as well. And so once I was able to do that, my level of comfort really went up in working with elected officials. But we work. We have folks all across our lines of service who advocate, who are really effective advocates, and I would say the main thing is effectively telling your own story and why a certain policy, proposal, or issue really impacts you.
Yeah, thank you so much, Susan. Just one question before we close this session. I wanted to know, based on your own experiences doing advocacy with legislators, as Atlas Core Fellows, what would you recommend as a takeaway, drawing on your own experiences dealing with policy practitioners coming from very grassroots organizations? What kind of lessons and takeaways can we have in sort of being successful advocates of our own respective work? Obviously, the context is going to be very different, but what are the 3 key areas that one should focus on while leading with advocacy? Could you quickly just expound on that?
Okay.
Okay,
so takeaways on grassroots advocacy. So I would say, on that again, I just can't emphasize enough that you are the expert of the work that you do. Also, some other pieces are celebrate success. So we are often playing a long-term game. We don't often expect to have immediate success after one legislative session. You need to focus on the long-term game and celebrate every little victory that you get, especially if you're working with other folks and trying to keep them engaged in the process. So understanding that big picture is really critical. And maybe the success, maybe you don't get as far as you want to get in the first year, but eventually you will get there. If you look at some things that have really, kind of changed course over the last few years, many of those folks who worked on that wouldn't have expected them to change. You just don't know what it's going to be that is sort of the hook that might move a campaign further along. And then the last thing I was going to say, which when somebody asked the question about, what kind of skills for advocates, a really helpful thing to do, and I should have mentioned earlier, is before you talk to those elected officials, make sure you do the background research on them. It's really great to, it's just like any sort of, building a relationship with people that you work with, is get to know what their thing is. Maybe you have some things that you can identify with them on, and you can figure out kind of what their hook is. For us, it's wonderful when it comes up that an elected official, for example, has a child with a disability. Then that person is more likely going to listen to some of the work, to what we're talking about when it comes to disabilities. Often another thing that we run into is that many elected officials, maybe they've adopted a child through our organization, or they've just adopted a child, period. Maybe they're a Lutheran, and we certainly work with everybody, but that's a nice connection that you can make. So I think looking at you know, what sort of rapport you can build and connections you can make with those elected officials is going to be really helpful to the work that you do. And you know, it's great to walk into that office and feel that helps you to feel more confident too in your conversations with them.
That's all the time we have for now. Thank you so much, Susie and Munya, for joining us today and sharing your knowledge with the Atlas Pro community. I also want to thank the fellows who joined us for the live broadcast. And again, don't forget to fill out the feedback form for this webinar. This is Yunus Chaudhary, your training manager, signing out. Goodbye.